According to the 2019 Florida Diabetes Report, in 2016, the highest prevalence of diabetes was found in these three counties: Baker, Hardy, and Gadsden. Baker had a rate of 22.3%. Gadsden had a rate of 23.4%, and Hardy had a rate of 23.6%. My county had the highest prevalence of diabetes that year. Diabetes makes your blood sugar very high. You can measure blood sugar with a blood glucose meter. I will be showing how to do that today. I will discuss the blood glucose target ranges, and I will just dissect the results different people may receive from these meters. To begin with, gather your blood glucose meter, your test strip, your needle, and your lancing device, and your alcohol swab. Make sure you wash your hands before setting up your meter or by using an alcohol swab. Insert your test strip into the test port to turn on your meter. Face up until it beeps, and you can see a blood drop on the screen. Next, obtain your blood sample by using a lancing device to prick your fingertip like this. And press this trigger button. You can also obtain a blood sample right on your forearm. You just have to wash the area of the arm you want to be lanced, and then you can just rub it to increase blood flow, and then you just press on it like you do for the fingertip. Then you can you hold your fingertip or forearm to the test strip, and then it would show your results in at least 4 seconds. And then you can press this button to take the test strip out and discard it. You can also discard your needles safely after using them. Now that you've checked your blood sugar, let's discuss what blood glucose level you should be expecting. Before a meal, a person with diabetes glucose level should be between 80 to 130 milligrams. After a meal, a diabetic person's glucose target should be less than 180 milligrams. Before a meal, a non-diabetic person should expect blood sugar levels from 72 to 99 milligrams. After a meal, their level should be less than 140 milligrams. In my last point, you will confront your results and see what they entail. If your results are between 100 to 135 milligrams. That means you are qualified for prediabetes. People with type 1 diabetes experience low blood sugar episodes. Other causes for high glucose levels are hyperthyroidism, Cushing's syndrome, traumatic stress, and medications, and pancreatitis. If your results show 70 milligrams or lower and you do have diabetes, that means you have a low blood glucose level. Low blood sugar episodes can occur in people with type 2 diabetes according to the medications they take. Non-diabetic people experiencing low blood glucose episodes may be having caused by liver disease, kidney disease, hypothyroidism, Addison disease, alcohol use disorder, or insulinemia. One low blood sugar test result should not be a case of emergency. Let's go over what we learned today. We learned how to measure our blood sugar level using the capillary method. I explained the blood glucose target ranges for diabetic and non-diabetic people. I showed you how to prepare and operate the glucose meter professionally, and I analyzed the results of scoring high or low blood glucose levels. And let me close by saying that if you're looking for resources to treat your diabetes, the answer is to look at things like diet attitudes and communication strategies according to Assistant Professor Diana Naranjo.